Low tidal volume alarm. What's missing? This alert triggers when the air reaching the patient's lungs falls below the programmed threshold. It is a critical warning that your patient is not receiving the full breath volume required for adequate oxygenation. We must immediately identify why the ventilator is signaling this shortfall. This alarm signifies that the delivered breath volume is lower than expected due to physiological or mechanical factors. Common causes include air leaks in the ventilator circuit, a deflated ET tube cuff, or weak patient inspiratory effort. Furthermore, poor lung compliance or high airway resistance can physically block the air from entering the lungs.
To address this alarm, systematically check all circuit connections and the endotracheal tube cuff for any audible leaks. Assess the patient's respiratory drive and auscultate lung sounds to determine if they require suctioning or pharmacological intervention. Managing low tidal volume means constantly verifying both equipment integrity and patient response.